Okay, good evening, everyone. Welcome to another Wednesday evening with the Clear Mountain Monastery community. This evening, it's my deep joy to introduce and to have Dr. James R. Hillard on the episode. So welcome, Dr. Hillard.
Oh, thank you, Venerable Ajahn Kovilo.
So in addition to being a physician, a psychiatrist, Dr. Hillard is also my dad. So
yeah, I prefer to call him Kovi, actually, because nothing can make you feel older than having a son who's venerable. Anyway, sorry, please go ahead.
That's right. You and Mom are the only people who call me Kovi. I guess Nat and Elena do as well. But I'm going to read your biography. So Dr. Hillard is a Distinguished Life Fellow of the American Psychiatric Association. He has been Professor of Psychiatry at MSU, CMU, and the University of Cincinnati. He attended University of North Carolina, Chapel Hill for undergrad and Stanford for medical school. At University of Cincinnati, he was chair of the Department of Psychiatry for 18 years. At Michigan State University, he was associate provost for human health. He has published 2 books and over 100 papers on a wide range of psychiatric topics. He survived metastatic stomach cancer, diagnosed in 2010, and is one of 100 Stories of Hope for the 110th anniversary of the American Cancer Society. He combines kindness and a sense of humor with wide-ranging medical expertise. And as I mentioned, you're my dad. So welcome onto the show.
Right. And of course, being your dad is what I'm proudest of.
Wow.
Although pride's not a good Buddhist thing, is it?
No, I think we'll get to that. So,
oh, okay.
Yeah, there is a wholesome sense of pride, which I think we'll touch on via a cartoon. So, Dr. Hillard, and maybe I'll just call you Dr. Hillard for the rest of the episode, if that's okay.
No, it's okay, I suppose.
Okay. So, Dr. Hillard had the idea to show these cartoons, actually, which growing up, he would read me cartoons just as a fun thing to do on the weekends. And maybe about 3 years ago, he suggested that I start drawing cartoons of he and I. So with that in mind, I created this cartoon series called Psychotic, The Charming Adventures of an Atheo-Psychiatrist Father and his Buddho-monastic son. So
that's us.
That's us. Yep. You're on the right and I'm there on the left. So, and I thought maybe to introduce things and to go into this object maybe of wholesome pride, like you suggested, this is one particular cartoon. So maybe we can try to read this. Okay. So this is me talking at the beginning. Oh, Dad, before I forget, I wanted to share a neat contemplative practice I've learned. Basically, the idea is to think of 3 things you've done in your life that you're most wholesomely proud of. Once you've got them, then the next step is to recollect them often so as to counter feelings of self-criticism and to nurture real joy. Just hearing about this practice, does anything come to mind for you?
Yeah, that's a profound question. So I want to think about it a little rather than just say some random sarcastic junk.
That's a good idea. Okay, then you're thinking and thinking again. But then I have an idea. Oh, I've got a good one for you. How about that time you did your part to get me birthed and then housed and then clothed and fed and schooled for 18 years or so? I, for one, think that was pretty awesome.
No, that wouldn't be fair. Then I'd have to put your brother and sister on the list, and there'd be no place for when I beat Zelda on Nintendo.
All right, okay. Point taken. So that's just one example of the maybe 24 or so cartoons that we have in the Monk and Dad series, which are published. That website is actually one which Ajahn Nisabo created called The Fourth Messenger, which is an outlet for monastics to have a creative impulse. So what do you think about that question? I mean, I was reading your accolades, but yeah, looking back, you've been a psychiatrist now for coming on 50 years. What do you look back on with that wholesome sense of pride?
Well, okay. Well, there is you and your siblings, and there is Zelda. And then I did just make it to 1,100 days on Duolingo. But I guess that was just some more of that sarcastic junk. I really do think that I've done more good than harm being a psychiatrist. And I've also spent a lot of my career teaching, and I think I've really taught a lot of other psychiatrists how to be more helpful than harmful. In fact, one of the things I try to do is teach people that treat your patients like they are sane and treat doctors like they're insane, and that almost always works.
Well, that reminds me of when I was young, probably elementary school. You gave me a piece of advice. Is that you said when you're thinking about what profession you want to be, when you're thinking about what you want to be when you grow up, you should look at the people who are in that profession and see, do I want to be like that person? So I thought that was great advice, and that really did influence my decision to become a monk. Meeting great teachers, Ajahn Pasano, Ajahn Amaro, who I ended up ordaining with, and just my brother monks as well are just great examples. What was it that made you want to go into psychiatry? What was that impulse?
Yeah, well, I was originally planning to go into psychology, and that was because I was a narcissistic asshole, and I thought nothing was more fascinating than my own brain. Then your mom was going to medical school, and I just said, well, okay, so I'll do psychiatry rather than psychology. So I did all the pre-med courses in 1 year. And I think it was the right choice, for me anyway.
Okay. Did you have any mentors? Were there any psychiatrists in the department where you were studying that, or in the university where you were studying, that really were inspiring examples of good people?
Well, I would say I've only had 2 mentors in my career, both of them when I was at University of Cincinnati. And so one of those was Marshall Ginsburg, who was like my boss for the first few years I was there, and then I was his boss. And he really cared about people with psychiatric illness. He's older than I was, and so when he went into it, there were not very many effective treatments. And so I asked him one time, well, wow, there were so few effective treatments. Why did you even go into this? And he said, well, because the need was so great. And so that was inspirational. And the other was actually like an internal medicine doctor. He was dean of medicine most of the time I was in Cincinnati. He was my boss. And unlike most physicians, he was not, a major narcissist. And he was a little bit on the Asperger's side, which, by the way, is no longer a diagnosis. They changed that to autism spectrum.
Yeah, so you've mentioned narcissism a couple times, and I think when you sit down to meditate, one of the first things that you notice is all of your conceit, and I think any meditator might be the first to tell you how narcissistic they are. But you talk about how the reason you were thinking about psychology was that your own mind is the most interesting thing. But one of the things that I love about our conversations, I mean, not the live ones like this, but when we're just talking on the weekends, is that when you talk about the mind, I mean, you've been studying the mind both in an academic and intellectual, professional setting, but also just being with your own mind and the insights that you've had into other people's minds, they extrapolate. So when you talk about your patients or different medical conditions, the autism spectrum or narcissism or any other anxiety, depression, all of these really do have their correlates in a Buddhist expression of things, just because they're states of the mind. So I find that fascinating, just how insights from one field, your Western approach, really do mirror quite well with the Buddhist approach.
Right, and I've learned a lot from you also.
Well, maybe we could go more into the autism spectrum. I mean, you brought that up. Could you say more about how you feel that dropping the what now it's called the autism spectrum, but it used to be called Asperger's. Could you say any more about that? Because I don't know this for certain, but it might be the case that a monastery or a meditation center is somewhat self-selecting for people who are somewhat on the spectrum. We also have, social geniuses, I'd say, like Ajahn. But please.
Yeah. And it may be best, to have somebody who's a social genius sharing a monastery with somebody's a little aspy. But and again, I don't know. In general, I mean, some of our psychiatric diagnoses make sense, and some of them don't make as much sense. And sometimes, when people ask, "Do you think I'm autistic?" I say, "Well, no, you're just a weirdo." And so that's one end of the spectrum. And then those guys on Big Bang Theory are sort of the other end of the Asperger's spectrum. The people who are really autistic and nonverbal, I don't think are really on the same spectrum.
So you have mentioned both for your present job, working at Health Stance, or Life Stance, excuse me, you mentioned that one of your specialties is mindfulness, or one of your interventions is mindfulness. Do you think mindfulness would be an appropriate suggestion for someone on the spectrum, or is there any?
Yeah, I think it's really good for practically anybody that, psychotherapy goes through, like, sort of trendiness. And actually, one of the flavors of the month lately is mindfulness therapy. And again, I think one of the reasons, you'll probably agree with this, one of the reasons people are miserable is clinging attachment. And, a lot of people who are depressed or anxious, it's because somehow they don't feel like they're living up to something that they're supposed to have lived up to. And they lose track of what's happening in their lives now, what's happening in the world around them. Well, they're still clinging to what they think they should be like. And so I think that is what I think about as mindfulness. And I think that probably is similar to what you think too.
Yeah, certainly. I mean, that's straight from the Buddhist texts and my own experience, this idea that mindfulness is good all the time. There's a set of teachings called the 7 enlightenment factors, some of which are stimulating and some of which are relaxing. So you've got, on the stimulating side, you've got joy and analysis of dhammas and energy. And on the relaxing side, you've got tranquility, concentration, equanimity. But mindfulness is said in that discourse and elsewhere that mindfulness is always helpful. It's like the fulcrum that you can balance these other, more vectored, more weighted mind states. So, I definitely agree with that. And one thing which is interesting about our conversations is that we have different vocabularies.
Yes.
I'm speaking, I know I've been studying Pali and reference Theravada suttas quite often, and have basically a Buddhist hybrid English vocabulary that I use. You mentioned clinging attachment. Is that something you speak about in psychiatric or psychology circles, or is that something you've picked up from Buddhism?
Yeah, that's what I got from you, actually. And I use that with patients also. And look, I'm not trying to convert you to Buddhism. In fact, one of the great things about Buddhism, Kovi, you don't try to convert people either, do you?
It's true. It's true. Yeah.
And so, yeah, I guess I talk about it sometimes too, is neglecting like reality in favor of, your fantasies about what reality ought to be. And that's kind of similar, isn't it?
Yeah, totally. Yeah, I mean, that's what we cling to. How about the term mindfulness? I mean, this is, it is, as you say, somewhat a flavor of the month, but it's been a lot longer than a month since, there have been, thousands of, by now there's probably tens of thousands of scientific articles on mindfulness. Is this enough in the mainstream that you can recommend mindfulness or even teach mindfulness exercises to your patients?
Well, yeah, it's definitely to recommend. I'm not sure I'm quite narcissistic enough to say that I can really teach it. But what I do suggest with people is they do start the day just trying to clear out all the trash that's accumulated in their mind and really get in touch with their body and really to let thoughts come in and then let go of them. And so I think that's actually something I kind of learned from you. And the only meditation technique that I really encourage people to do is to breathe in and think and then breathe out. And so it's accept, let go, accept, let go. And that's a very therapeutic message for practically everybody.
The fact that you would bring people back into their bodies, I mean, this is, the go-to in monasteries when someone is starting to, display symptoms that are outside of, normal limits, whatever those are. If someone's, starting to maybe mention, talk about seeing things which other people don't see, if people are starting to get depressed, if they've got a lot of anxiety, all sorts of things which people come to you for when they get over a certain limit. But what we recommend for these people who are just only starting to exhibit these qualities is just come back to the body. I know you want to meditate a lot because that's how Buddhism is framed in the West, is meditation or bust. But really, suggesting that people, young monastics or people staying in monasteries, really get back into their bodies. Chop wood. Very embodied things. I'm glad to hear that. Is that common in the psychiatric circles that you were educated in, or is that?
Well, no. I mean, practically everything I was taught in residency, I now regard as stupid. That, we had a very psychoanalytic framework in my residency, and I now regard that as just what?
Okay.
And on the other hand, the positive aspects of it are really listening to your patients. And, a cartoon I've got in my office now, which is kind of a joke, but not completely, is the psychiatrist saying, handing a prescription saying, I medicate first and ask questions later. And it is one of the things that's happened during my career is that, as we've gotten more effective medications, which are way better than what we had when I was in residency, that has gotten to be the major thing that psychiatrists do. And most of the psychotherapy gets done by psychologists or like psychiatric social workers. And I don't know, I mean, one of the things I think about, if you want to be a psychotherapist, you have to have the courage to every once in a while say something that's totally stupid and banal. Mm. And one of the ones I occasionally use is, if your only tool is a hammer, everything looks like a nail. And it worries me a little bit that, there is so much to learn about medication and psychobiology and neuroscience now, that a lot of psychiatrists being trained now don't really learn very much about psychotherapy or mindfulness. So anyway, in terms of teaching people, I try to help them understand the difference between what are things that really are brain disorders. And, bipolar disorder is that. Schizophrenia is that. Major depression disorder is that. And people who try to bypass really getting, who really are suffering from those, and try to bypass that and go directly to meditation, often that can make things worse in the short run, particularly people who are psychotic. And really what I think about psychotic is not being able to tell the difference between what's going on inside your head and what's going on outside your head. And so, I try not to overuse medication, but I try not to underutilize it either. And so many people fall into thinking, if I'm a good enough person, if I meditate enough, that will cure whatever's wrong with me. And that doesn't work for major physical illnesses, and it doesn't work for major psychiatric illnesses either, or so I believe.
Yeah, no, there's a lot there. And I mean, you mentioning that these days modern psychiatry really leans perhaps a bit too heavily into psychopharmacology,
Yes.
Prescribing medication. There is also, especially perhaps in the forest tradition of Buddhism, a certain cohort of people who are really anti-medication and do, as you're saying, think, oh, I can solve it all by meditation. If I just, meditate more, then I can get these thoughts, these visions under control. And just to say that, I have had teachers who I respect who have actually recommended to students of theirs, both lay people and monastics, to actually look into pharmacological solutions. So,
yeah, well, somebody I think about in this regard, I haven't actually read all of it, but Ajahn Chah suffered from diabetes, and he did get that treated. And again, I really think that, for severe and persistent mental illness, it is a lot like diabetes. And you can't make diabetes go away. Even Ajahn Chah couldn't make diabetes go away. And I don't think people can just make major mental illness go away. There are a lot of people, though, who suffer a lot. Something I treat a lot lately is what's called borderline personality disorder. I don't like that name. What it's called in Europe is emotionally unstable personality. And the way I think about that is the symptoms of it are really over-attachment to people and desperate attempts to avoid abandonment, having an unstable sense of self, tending to do impulsive and often self-destructive things. And I don't, and again, a lot of people who have this do develop depression and anxiety on top of it. But I do kind of think that people are born, you know, either relatively sensitive or less sensitive. And if you're born sensitive, then you just grow up to be a nice, sensitive person if you have a good growing up environment. But if you have a bad growing up environment and you start out as a sensitive person, then that gives you these borderline traits. And so I feel like that's one where we really are just treating the symptoms. And I think that's one, too, where mindfulness is really a cure, whereas what I'm doing with the medication is just a Band-Aid. For somebody with schizophrenia who is having, hallucinations and delusions all the time, that's something that really is not going to get better. And in fact, it may get worse with meditation.
Meditation.
Yeah.
So one thing you mentioned there is this idea of people having an unsettled sense of self.
Yeah.
So one of the things that we do in Buddhist meditation is actually intentionally unsettle and question the sense of self. How would you caution, and for someone who's psychologically well-adjusted, it's a fascinating exercise to look for, where is the center? Where is the center of this thing I call a self? What is the essence of it? But for someone who has this dissociative or personality disorder, I can imagine it would be quite traumatic. And even I'm curious if you've met people who've had meditation-induced psychosis or meditation-induced psychological problems at all, or if that's still too new a thing in America.
Well, no, it's rare, but I have seen it. And so for people who are deeply troubled, they're hearing voices outside their head talking about everything they do, and generally saying derogatory things about them, then going deep inside really can make the hallucinations seem more real. And it is, as I say, it is rare, but I have seen it. And I think if people are already having hallucinations or believing that, I don't know, the devil is at work in the world, these are people who probably should get psychiatric treatment before they start heavy-duty meditation. Something you told me about one time, the first time you did Vipassana, was after doing it for a while, your teacher said, and now after being inside for a while, you realize that you're insane. Do you remember telling me that?
I don't remember that, but I think I have said things like that, and I mean, of course, it's not a clinical, I wasn't speaking about, clinical insanity on any kind of, but I mean, just watching your thoughts, I definitely was so surprised. I was a normal, good college student at the age of 20 when I did my first Vipassana 10-day silent meditation retreat, meditating 10 hours a day. I just never sat down with myself and just tried to focus on one object, the breath, or scanning the body, and was just amazed by just how out of control my mind was, the range of things I was thinking about, the total dissociative clang type thinking where associating one thing to the next. And I mean, they didn't, if someone were to track all those thoughts, it wouldn't, write them down. It wouldn't be the linear thought progression of a sane person. So I mean, wasn't saying I was clinically insane, but what do you think about that? I mean, that most people, if you were to record their inner diary, their inner speech, might seem further on this spectrum of, mentally unhealthy or,
Yeah. I mean, something I've kind of joked about before is that, you don't get in trouble for having delusions. You just get in trouble for having different delusions than everybody else has.
Mm-hmm.
And so I do think really focusing on what is really going through your mind and letting go of it does give you, you kind of can't hold on to the same delusions everybody else around you has. And they think you are insane.
So what would you recommend for a meditator or a monk who does start seeing things that other people don't see? Where's the line when you think that person should maybe start seeking help? And this is somewhat confounded. And this is, it is my belief. And I met people who, have capacities of the mind which are just unusual, that most people don't have. And I don't totally put it outside the realm of possibility that there are, psychic phenomenon, that someone could see things which, even though other people don't see them, actually are there. So I do believe in other realms, of existence, and there's reports both, in the canon and elsewhere that of people seeing ghosts. So this is something. What do you think about all that? Yeah.
Of course, I'm more into the rationalist tradition, but I do think that, it's something I've thought about a lot is the difference between being psychotic and being psychic. And again, psychic has all these bizarre connotations that go with it. But when people, I think, are having a real spiritual experience, it feels good. Whereas if people are really psychotic, it feels bad. And again, in terms of hearing things, that I think most people from time to time kind of hear things, but mostly experience it as a voice inside their head. And often is saying just a few things at a time, whereas somebody's really psychotic, it's like a clear voice outside your head talking on and on about everything you're doing. And so I think that's different than what you've experienced, or is it?
Yeah, I mean, just to say, I haven't really had these type of psychic experiences of seeing other realms, other beings, angels or whatnot. But no, what you say about the difference between psychic and psychosis, of being the affect, the result, is it leading to feeling good or feeling bad? I mean, that's a really important thing to be tracking. So, I mean, and just to say how it can change, I mean, I've got a very good practitioner friend who was doing a lot of meditation, many, many hours every day, actually staying in a meditation center, practice center, and then starts to hear the teacher of this place give him instructions when that teacher was in a different room. This goes on and he thinks, oh, this is great. I'm just picking up psychically and he's giving me good advice. He's telling me to meditate more and it's all going well. But then the voices started changing and things started going downhill, pushing him too far. He started sleeping less than he needed or less than was healthy. And I think these things can change from possibly psychic to psychosis. And
and hearing voices is not always a bad thing. A few years ago, I had a patient who had murdered someone, and I took him on as a project. And, he would be talking on and on, but, every time I saw him, sooner or later, he'd get on to, or something along those lines. And so whenever he would do that, So well, let's step back a minute. Might there be another way to deal with that? And I wasn't sure whether I was really making much progress until he said that one day, I was about to cold cock somebody, but then I heard you talking to me. Isn't there another way to do this?
Nice. No, that's really exactly training. This executive function is really a lot of what meditation is, Dhammavicaya, having a meta cognition, META, hopefully with meta, with two T's, which can really just watch what you're thinking and say, okay, Ajahn Chah gives this simile of like a bull. If a bull is going this way, you just tap it on the left side. And then if it's going too far this way, you tap it on the right side. And having an inner Dr. Hillard that can tell you, yeah, maybe you shouldn't cold cock the guy is a good thing to develop, I think.
Although I must say probably having an inner like Covey is more good than having an inner Dr. Hillard.
No, we should have both. The inner committee would be great. Well, let's go to some questions and comments. So the first question, or it's a comment from Ajahn Nisabo. So he says, "Hello, Ajahn and all. It's great to meet you, Randy. Thank you for giving us such an amazing monk son." That's from Ajahn Nisabo, who his parents, they call me their monk-in-law. So you can consider Ajahn Nisabo.
Oh, that's good. And of course, what my granddaughter calls you is her munkle.
That's right. All right. Well, a lot of appreciation here. And this is just from one of our regulars, Mary. Congratulations on your survival after stomach cancer. How did you use your mind to help in your healing?
Yeah, it's an interesting question. I don't know. I mean, initially, I was planning just, the treatments had so many side effects and they were so ineffective. I initially thought that, okay, great. I'll just go ahead, have as much fun as possible for about 6 months and then die. And there was a new treatment that came out, Herceptin, originally a breast cancer drug, was approved for stomach cancer just a few weeks before I was diagnosed. I'm still getting it every 3 weeks. My original prognosis was maybe 6 to 9 months. And keeping the faith that it was possible against the odds that I would survive, that really helped me stay with the treatment. And I would say it's more, the effect, I don't know, and the way I feel kind of, I don't know, like you're supposed to have these major insights when you have cancer. And I did have some of those that one was I realized I'd spent most of my life as a mindless careerist robot. And anyway, it did help me get in touch with, well, okay, that didn't really matter all that much. And unfortunately, or fortunately, I've noticed that, now it's been 10 years, I've kind of drifted back to roboticism to some extent. And anyway, really and truly, to the small extent that I actually do meditation, that does help bring me back to, okay, that was a real illusion that I was chasing. Kind of like Angry Birds, which, as you know, I've been addicted to for quite some time, that it is, you are spending real time, and if you were really sucked into it, real money, pursuing imaginary rewards. And I realized that a lot of my climbing my way up the career ladder was kind of like playing Angry Birds.
Well, I'm hopeful you're going to be retiring soon. So I'm hoping that you'll fill a lot of that time with meditation and spiritual reading as opposed to Angry Birds?
Well, I am planning to do that, although I don't know if I told you about this yet, I decided rather than completely retiring, I would just, cut down my hours, which is kind of nice because I'm keeping all the patients I like and I'm referring the patients I don't like to other people. I know we're not supposed to have patients we like and ones we don't like, but everybody does.
Well, let's get some more questions. We got a lot here. Oh, here's one. Okay. Why are there so many narcissists, and what's the best thing adult children of narcissists can do to heal?
Yeah, that's a very difficult question. And are there more narcissists than there used to be? I don't know, but it certainly is kind of an epidemic these days, because so much of love is contingent. And I think I even did that to you to some extent, that, got to do well in school, got to defeat the competition. We won't even go with the cartoon that you did about my suggestions before soccer games. And, I think when parents focus too much on achievement and less on virtue, that can leave you feeling, being narcissistic. And so how do you heal from that? I think mindfulness works better than anything else I've come across. And so, like, it was something I say to patients sometimes is, yes, well, like everything else I say, it's easier said than done.
Gosh, we've got a lot of questions.
Oh, good.
Here's one. So, Dr. Hillard, do you have a regular meditation practice, or do you still plan on almost meditating? This is a reference to this cartoon. I'll call you up and I say, "Happy birthday, Dad. Do you have any meditation goals for this new year?" And can you see your response?
Yeah, I'll plan to almost meditate on Monday. I'll plan to almost meditate on Tuesday and plan to almost, and then look at how, like, Covey is looking there.
That's right.
I'm doing a little better, that sometimes I actually do meditate. And I have no stock in this company, but the Waking Up series that Covey originally recommended to me has been helpful when I do it. And it is, I don't know, it's a couple of times a week usually. So I don't know. I think I'm doing slightly better than almost meditating.
Well, let's do a lightning round, because we've got a couple of, and I mean, some of these are deep questions, so it'll be difficult, but we need meaning in life to be happy, I guess. Is there an inherent meaning in life, or do we have to find our own meaning that is individual to our circumstances, as the existentialists seem to say?
Yeah, that's how I've always thought about it. What do you think?
Yeah, I mean, in terms of inherent, I'm not sure. I don't usually think in that way, but I mean, you can give meaning life, and certainly, I mean, you can't, one of the reasons that Buddhism appeals to me is just, you can't deny suffering. It's the first noble truth, and no one can, and that's a universal, just figuring out a way to not suffer. And it's not easy, actually, just to not suffer, so.
So everything you say also is easier said than done.
Yeah, totally. All right. Dr. Hillard, this is about psilocybin. I don't know if you want to answer this publicly, but what's your opinion about psilocybin?
Oh, sure. I don't care. I actually wrote up in my blog about when I started using medical marijuana. I have used psilocybin on a number of occasions. It's been a long time since I used LSD, and that actually psychotropic, medication like psilocybin, LSD is having a moment in psychiatry. The place I really became a convert, I suppose, I had a friend who was, I've had a lot of stomach cancer friends, and one of them was a young woman, had these wonderful children. I even visited her at her home one time, and she said that having like psilocybin treatment helped her overcome her fear of death. And so I do think there is, there's some real potential in this. It is something too, though, that if you already have kind of a tenuous grip on reality, it, can mess you up.
Well, I think that might be all the time we have.
Oh no, I was having fun.
We will be going over to Zoom, so that's another chance for people. I just put the link in the notes, or in the chat, so people can check out there. And yeah, Dad, you'll be over there, won't you?
Okay, yeah, if I can figure out how to do it.
Yeah.
Was I appropriate?
I think so. I mean, I might have to go back and bleep out that A-bomb that you dropped, but...
Oh, God, I don't even remember that. At least I skipped some of the other words that I tend to overuse inappropriately.
Dad, thank you, Dr. Hillard. Thank you very much for joining, and we would love it. I'd love it if you could meet many of these people in person, and for them to meet you at some point in Seattle. So
Brilliant. Okay, I will definitely figure out a good reason to be there. Now, if I can figure out a good way to get onto Zoom. I am a baby boomer.
All right. Thank you, Dad. We'll close up and go over to Zoom. See everybody over there. Bye-bye.
Bye-bye for now.